9 warning signs of wrist tendinitis. You must know. Did you know? If left untreated, wrist tendinitis can lead to chronic pain, loss of mobility, and even long-term damage to your tendons. Ignoring the early signs could make simple tasks like typing, gripping objects, or even holding a cup of coffee incredibly painful. So let's talk about 9 warning signs of wrist tendinitis that you should know. What is wrist tendinitis? Wrist tendinitis is the inflammation of the tendons in your wrist, often caused by repetitive movements, strain, or overuse. Tendons are thick cords that connect muscle to bone, and when they become irritated, they can cause discomfort, swelling, and stiffness. If you use your hands frequently for work, hobbies, or daily activities, it's essential to recognize the warning signs early to prevent long-term issues. 1. Pain that worsens with movement. The most common early sign of wrist tendinitis is pain, especially when you move your wrist, grip an object, or rotate your forearm. This pain might start as mild discomfort, but can quickly progress if ignored. 2. Swelling around the wrist. You might notice swelling on the top or sides of your wrist, which can be accompanied by a warm sensation. This is your body's way of responding to inflammation and irritation in the tendons. 3. Stiffness in the wrist or fingers. Do your hands feel stiff, especially in the morning or after periods of rest? If your wrist feels locked or restricted, tendinitis could be the cause. 4. Weakness when gripping objects. Have you started dropping objects more frequently? Weakness in your grip strength, like struggling to hold a coffee mug or open a jar, can indicate tendon inflammation affecting your hand's functionality. 5. A dull, aching pain at rest. Even when you're not actively using your wrist, you may feel a lingering ache. This discomfort may become more noticeable at night or after a long day of activity. 6. A popping or clicking sensation. A snapping, clicking, or popping sensation when you move your wrist can be an indicator that the tendons are irritated and not gliding smoothly over the bones. 7. Increased sensitivity to touch. If pressing on the affected area of your wrist causes sharp pain or discomfort, your tendons are likely inflamed. This tenderness may extend from the wrist into the lower forearm. 8. Burning or warmth in the wrist. A persistent burning sensation or warmth in the wrist can be a sign of increasing inflammation. If the affected area feels noticeably warmer than the surrounding skin, it's time to pay attention. 9. Difficulty performing everyday tasks. Tying your shoes, brushing your teeth, or even lifting light objects might become difficult. If you find yourself modifying your movements to avoid discomfort, wrist tendinitis may be affecting your mobility more than you realize. Ignoring wrist tendinitis can lead to chronic pain and long-term complications. However, when caught early, it's manageable through rest, proper wrist support, and physical therapy. If you're experiencing any of these symptoms, especially if you frequently engage in repetitive hand and wrist motions, talk to a healthcare professional to prevent further damage. We hope this video helped answer your questions about wrist tendinitis. Don't forget to like and subscribe for more videos on wellness and natural health. Stay proactive about your health and take care of your wrists. They do more for you than you realize.